Hello there, it is Dr. Fern here, and you medicine women are here right now if you want a life you absolutely love. So we all know how disastrous cancellations can be at the last minute, and so I have gone through so many issues and training to get to a system that I'm pretty happy with right now, because the truth is we need to educate our patients on how to respect our time and to realize that cancellations for our clinic cost us a lot of money. And in doing so, we also have to we have to have integrity, and that means that we also have to respect the patient's time when we cancel. So I always give them some type of small compensation if I have to do that in some way or form. But what I do with the cancellation policy is that it starts with my front desk team, really knowing and cementing that cancellation policy right at the start, right when patients book that first appointment. They repeat it and they even say a why to it. And patients usually are okay with that. And usually we attach something like $100 to it, and we call it a cancellation fee. So now I have to tell you that the key here, my purpose is not to penalise the patients when they cancel. It is actually to educate them on why we need to value our time, on why they need to value our time. So it's not about penalising and getting that $100 that is insignificant, it's consequential to the clinic and what the turnover is, but really it's about educating the patient and training our patients so that we don't get serial cancellers. And what we do first is at the first appointment, we say that there is a cancellation policy, and we iterate it, and it's in our email handout with the first appointment schedule. And then if they do cancel, we also listen to the reason why. There's only so many times when someone has to go to the hospital or someone's mum's dies. And so when we listen to it, we empathise. And the first time the girls empathise and are on the patient side, so they want to show the patients that they are on their side, and they say, look, Mrs. Jones, can you hold on a second, I'm just going to bring up your file. And of course we have a look to see how many times this patient has cancelled, whether it has happened numerous times, and if not, then we always say something like, okay, Mrs. Jones, I can see that this doesn't happen often and I really want to help you out here. You know there isn't usually a cancellation fee, but I'm going to do you a favour, and we're going to just take it as a deposit so we can reschedule your next appointment and you won't be charged anything for it, okay? So it'll just be taken as a deposit. And usually the patients then book in with a deposit, and they're happy that they're not getting charged a cancellation fee that was outlined to them right at the start. And then they book in with a deposit, and the second time, if the patient cancels again, then we have to say, well, usually we take it. But really, to be honest, we rarely take it. It's really listening to the patient, and it's an educational process to once again teach them, not penalise them. We never want to penalise our patients for doing something like that, because we also need to be empathetic. But at the same time, there is a push and a pull between, okay, how do we also protect our clinic's interests and our time and make that valuable? So then when you install this cancellation policy, and the way you say it to the patients is the girls need to show them that they're not just going straight for the cancellation fee. It's all about sitting there, empathising, listening, showing the patient that you're on their side, and how about we do this for you, Mrs. Jones, because I can see you're such a great patient. Giving them value, and using the deposit like a card for them, like a trump card for them, and saying, hey, Mrs. Jones, I can see, and I don't really want to charge you the cancellation policy, but how about I do you a favour and we just take it as a deposit this time to reschedule your next appointment. And it's in the tone, it's in the empathy, it's in the discussion with the patient that makes the difference. It's showing the patient value. If the patient becomes disgruntled, then we need to pull back and say, hey, what didn't work here? What was our tone like? What was the objection? And of course you can't please everyone, but really now I have trained patients who cancel to ring up, and as soon as they cancel, they say, look, charge me that cancellation policy, because they value and they know what's coming up, and it's all about pre-framing it right from the start. So I hope that has helped you, and I hope that has will reduce some of the cancellations, but it's all in the way your front desk are trained and speak to the patients, in empathising, in being on their side, not against them, not that this is our fee, but it's all about training and teaching them to value our time, and then we value their time as well. So it's reciprocation and integrity. That is my daily dose of Dr. Fern. If you like what you hear, please share this with your friends and dentists who might need this. It might change the way they do things. And remember, please keep laughing out loud. It is the second best thing you can do with your